Hey, Dr. Lindsey and Wendy here. We're going to talk to you about lowering the hairline in women. And there are really two choices. I'm a facial plastic surgeon. I've done 2,100 hair transplants, but I've also done 4,000 facelifts. And when you deal with bringing a tall hairline down, which is common in almost every white woman, certainly in the DC area, the hairline ought to be right about where the skull goes from vertical to horizontal. But a lot of white women tend to have a little higher hairline than that, which looks fine. But sometimes it's so far back that they become self-conscious. And so there's really two choices. First is you can do a reverse brow lift, where we essentially make a cut here. And rather than pulling up the brows and doing a brow lift, we undermine behind the hair and pull the hairline forward. And the advantage of that is that it's very quick. In roughly an hour, you get your final result because the hairline's brought down. The downside, though, is that it's pretty good sized surgery. I've only done them with people asleep, so there's some anesthesia issues that are involved. And there's a scar line that's fairly distinct. Even though I think I sew very well, there's still a very straight line of demarcation where the hairline starts that oftentimes we have to touch up with just a little small hair transplant. The alternative procedure is just to do a hair transplant and bring the hairline down. And so when I talk to patients, female patients about this, we talk about both of these. And I would guess that most female patients in our area choose a hair transplant because it's done in the office. There's no straight line of demarcation. And you get your results slower, and so it's not as noticeable to their friends and family. They can hide it after a couple days and just cover things with bangs. So this lady came in, and she's roughly 40 years old. She's from overseas, and we had the same discussion, and she wanted her hairline brought down. So here she is. This is the hairline that I suggested for her. And frequent viewers will know that all my male patients essentially get my hairline, but in females, you have to do a more broad hairline that curves down a bit. And so here's her plan, and then here she is after we packed 1,800 grafts in her. That was a good case,
That's
right?
Good. Yeah, perfect, yeah.
And then she came back at a week, and I believe she came back at a month.
Yes.
And then we didn't see her, and she rolled in unannounced yesterday at 6.5 months out, thinking that she had her final results, and she was already very happy.
Well, yeah, she was coming to show you how it had grown and how happy she was.
But she's only half done. I mean, it's the final results roughly 13 months out.
Yeah, so she was so excited.
Yeah. So she did this little video. She's from a different culture than we have, and she was very uptight about not showing her face. So you'll see my hand covering her face. But it's just real brief, so take a peek.
Let me film it right now.
Okay, so we are with this lady that's from the Middle East, and I told her I won't show her face, but you can see her before pictures on the side, and she just didn't have much hair. And you thought it was all done now, right?
You thought we were finished, that this was your result?
Yes.
And this is 6 months and 5 days, so I think you're going to look really good in another 6 months and 25 days, so 13 months out. How has it been for you? Have you noticed, are you happy? Or?
I'm very happy, really.
Okay.
And especially this is only 6 months, and
Yeah.
you said later, after 6 months, I will have great result. So
Yeah.
I'm really happy.
And what about your husband? We did it when your husband was overseas.
Oh, yes.
Was he happy? Or?
Yes, he's really totally happy, and he said that's a good result.
Okay, very good. Did I hurt you much when we did this? I know your child's here, but did I hurt you much?
She was taking care of her kids the whole time.
Right.
Yes, yeah.
You came the next day?
Yeah.
Much pain or not too much pain?
Not too much pain.
A lot of swelling though, right?
Yes.
Yes. Okay, well thank you so much for coming today.
Thank you, doctor.
So, I mean, she looks great. I like doing these cases because it's such a nice change, and it's a subtle change. She was able to cover her hairline in the work we did on her after 5 or 6 days, just by combing her hair forward. And she didn't see her husband for a month or two, and when she saw her husband, he was already excited about it.
He was. Yeah. She says he's happy with it.
Yeah.
He likes it.
Yeah. So these are easy little cases for us to do. I'm fairly fairly finicky on female hair transplants. And so if you are interested in this, two things. One is watch a bunch of our videos on how we do female hair transplants. And two, give us a call, and Winnie and I'll get you in and see you. Thank you.